Who is on the transplant evaluation team? Well, it's important to remember that transplant success requires a real partnership. There's the MGH Transplant Center and a number of professionals who work in the center to help decide who would benefit from kidney transplant and to help manage the kidney transplant. There are, of course, your primary physicians and providers, including your nephrologist at dialysis and your primary care doctor. And then, of course, there's you and your support system. Family and friends are absolutely critical to success with kidney transplantation. And
Hi, it's Linda, and I'm going to try and teach you a little bit about how to get on the kidney transplant list. So hopefully you've watched this program at home and have written down a bunch of questions to ask your team when you come to your transplant evaluation. And you'll be here for most of the day learning and meeting all of our members of our team. So at the initial visit, you'll basically get a chance to ask questions and meet with some other people that are also going through the same process as you. You will get a medical exam from the transplant nephrologist, who is just like your local nephrologist at home, but we're acting as a consultant until at which time you have a transplant, and then they will medically manage your blood pressure and your fluid status and your medications following your transplant. You also will meet a social worker to make sure that you have supports who are probably with you today. It's always absolutely advised to have somebody come with you to have a second set of ears to listen to all of the important information you're going to hear today. You also are going to meet with a financial coordinator, somebody who's going to make sure that you have insurance, the correct insurance, and the proper medication insurance, as you'll be on lifetime anti-rejection medication. Somebody who will review your nutritional status, making sure that you're eating and exercising prior to your transplant, and you'll get a bunch of blood and some urine testing done at that visit as well. This day is long, but it's a good part of what your evaluation consists of. All transplant candidates must review this presentation, meet with all of our entire team when you come for the day. You have to have chronic kidney disease or be on dialysis, which means that your filtration rate of your kidneys is at least less than or equal to 20 milliliters per minute. If you want to come to clinic to meet the team and with a filtration rate a little bit higher than 20, that's perfectly fine, knowing that when you reach 20, that's the point at which you can get listed on the kidney transplant list. You have to have a life expectancy of greater than 3 years. And you have to have social and emotional support, because you can't do this alone. It's a really hard process to take on all by yourself. You also, as we discussed, want to make sure that you have an appropriate insurance coverage. And if you have questions about that, you can bring those to clinic. And you also, all of the lab work that you do today will be reviewed, as well as 2 blood types on file to get you on the UNOS transplant list. People who do not qualify for kidney transplant would be somebody that has an active cancer, The anti-rejection meds that we may give you to prevent rejection can cause a cancer to become worse, as well as an infectious process. Same thing. The medications can actually make that infection worse. So we're trying to juggle the risks versus benefits for you as a transplant candidate. Anybody with psychoses or uncontrolled major psychiatric illness would not qualify for transplant, because you really need to be somebody that manages a scheduled medication regime and somebody who is able to get your laboratory work done as prescribed, and it really can't be interrupted, or you may reject that kidney. Active substance, IV drugs or cocaine or marijuana or alcohol is not okay. And any condition that is unlikely to improve, somebody that may not be acceptable for cardiac surgery and really have poor cardiovascular health, that may be somebody who we may do more harm than good. So we really want to prolong your life and not shorten it. The other big thing that comes to light is people with really high body mass index or very high obesity level. So our requirement is a BMI of about 40, and you can get evaluated if it's a little bit higher, but really you want to be on your way down, losing weight if you're that high at this point in time. And really, vascular disease is another important thing to think about. We really don't want to cause you to lose your legs. You want to make sure that you have good blood flow down to your feet, so that when we put the kidney in your abdomen, we don't put you at risk in any way. After your initial visit of coming in and meeting all the members of our multidisciplinary team, you can be listed for transplant if the team that has seen you that day agrees. And it takes about 1 to 2 weeks for that to happen. If your eligibility for transplant is uncertain, your candidacy will be discussed in the multidisciplinary meeting with everybody involved in the transplant process here at Mass General. And at that point, if there's any further testing, we will let you know what needs to be done. You and your referring doctor and your dialysis unit will receive a letter with a decision after our group meets and decides what needs to be done. Or if you're going to be listed, they will receive a letter as well. Once you are active on the kidney transplant list at Mass General Hospital, it's time for your donors to come forward and fill out an online health history questionnaire through the above website. In your education folder, you have postcards to give to all of your potential donors. This system is strictly confidential, and they will have their own team managing their evaluation. They will hear back from the donor team within 2 business days. It is important that you know that donor evaluations are complex and take anywhere from a few weeks to several months or more to complete. Though living kidney donation candidates are usually healthy, the ethics of live kidney donation requires that donor evaluations be extremely thorough, which takes time. Please be patient and in touch with your live donors as much as possible. The waiting period, if you do not have a live donor, can be long for a kidney transplant. During this time, it is important to communicate with Mass General via changes in your health, and you will receive a letter twice a year regarding your status on the list. It will tell you whether you're active, inactive, and how many days you have on the list. It is important that you maintain your general health care through your dialysis, lifestyle, good eating, and exercise. Keeping up with all of your routine care like colonoscopies, vaccinations, and your cancer screenings, including pap smears and mammograms, is important during this time. You also need to maintain adequate health insurance, and if that changes, you need to notify the transplant team. Also, maintaining support from friends and family for post-transplant care is important, because you'll need to call on some of these people for assistance after your transplant. Monthly blood samples are needed as you get higher on the list. We will send blood kits to you, or if you're on dialysis, to your dialysis center to be filled and sent back monthly. It is not necessary if you or your dialysis center does not receive these kits to complete this. So what happens when you get to the top, say 20% of the list, or you have a live donor ready? Then we really need to get you into readiness mode and to establish that you're healthy enough to actually undergo the transplant and receive anti-rejection medication. This occurs about 3 to 6 months prior to getting a deceased donor transplant, or if you have a live donor, or if you have accumulated enough waiting time for your blood type, or if your medical history would put you close to the top of the list. So this is when you go through all of your extensive testing, including all of your heart testing, ultrasounds of your heart, stress testing if advised. You want to make sure that you get your CAT scans of your abdomen done, any MRAs of the head for certain diagnoses, repeat blood work, and more kind of intense blood work at the time of readiness. And some people may need to see other physicians, including a pulmonologist, which is a lung doctor, a heart doctor, or a psychiatrist. And what will happen is you'll probably come back into clinic to just kind of see everybody again to make sure that you are still appropriate to move forward with transplant. So when an organ becomes available, when you've been waiting on the list for many years, it's kind of a shock to finally get that phone call. It can come anytime during the night or the day, so always keep your phone ready. Once you get into that readiness mode, you want to make sure your phone's on and by your bed as well, so that we can always reach you. When the nurse coordinator calls you, you need to just make sure that you don't eat or drink anything until you're instructed to. They'll like to know when your last dialysis treatment was, if you've started any new antibiotics or medications. It's a good time to tell them that. When the last time that you had anything, to eat or drink, and you basically want to jump in the shower and head to the transplant unit on Blake 6. And if you don't know where that is, there is somebody to show you the proper way as soon as you get into the hospital. You want to make sure you bring a list of your medications with you, no valuables, but probably your cell phone and some loose, comfortable clothing to go home in. The transplant may get canceled if the organ is not of good quality. That's something very, very important to know, because you could get sent home and not get a transplant, and that's an emotional roller coaster for all of you. Just know that it's a dry run, and that if you're getting close to the top of the list, you'll get another call before long. There are many clinical trials that Mass General is involved in, and this will help in the care of all transplant patients down the road. If you feel that this is something that you want to partake in to help yourself potentially and others down the road, you are not obligated, but Mass General wants to make sure that every transplant is better by doing testing new medications and treatments at all the time. So you may be approached. Again, don't feel obligated, but we encourage everybody to participate if you feel obliged.